Hello, everyone. Welcome to today's Science Talk. I'm delighted to welcome you to today's INWEH Science Talk. My name is Dr. Miriam Axel, and I'm thrilled to be your host. For those of you new to Science Talks, our weekly series highlights the exciting research of UNU-INWEH. I'm pleased to share that all of our previous Science Talks are available on demand, and you can watch the entire 2024 series as well as the recent 2025 talks. 2024 series is hosted by today's speaker, the amazing Professor Grace Oluwasanya. And you can find these at our website at unu.edu/INWEH/science-talks with an S. Today's talk, like all others, will be recorded and the video will be shared after the presentation. And we'll conclude with an interactive question and answer session. So don't wait until the last minute to put your questions for Professor Grace. Please use the Q&A box to share your questions. The topic of today is leveraging differential impact analysis in water and wash research. And I'm particularly excited about today's talk featuring Professor Grace Oluwasanya, who you'll know as the energetic and passionate host of the 2024 series of Science Talks. Professor Grace Oluwasanya is the project lead for water, climate, and gender research at UNU-INWEH. She's a professor of water safety and health with over 20 years of progressive experience in research, teaching, and research supervision in a higher education institute in one of the largest countries in the Global South, and a WHO-accredited Global Water Safety Plans trainer at international and country levels. She holds a PhD in Water Resources Management from Cranfield University in the UK and an MSc in International Land and Water Management from Wageningen University in the Netherlands, as well as a bachelor's degree from the Federal University of Agriculture, Abeokuta, Funab, Nigeria. Her extensive training in water resources management, or WRM, across developing and Western nations offers diverse opportunities to explore the many various aspects of WRM, including the associated socioeconomic themes. Professor Grace has a wide variety of experience in diverse work environments, from the UN, academia, national ministries, and private consulting with technical expertise in water systems risk analysis, water safety planning, capacity building, water gender interlinkages, and global policy development and advisory. Professor Grace is well published, and her recent publications include global reports on water security in Africa, a preliminary assessment, Unmasking the Unseen, the gendered impacts of water quality, sanitation, and hygiene, and a recent Springer Nature comment on quantifying women in the water workforce. I'm really delighted to introduce our speaker, and I'd like to start off with a couple of quick questions. Professor Grace, would you please share with us what first inspired you to pursue water resources management and how your early experiences influenced your career path?
Okay, thank you, Dr. Adel, and everyone, including my director, who is well seated. Well, to go straight to the question, I was inspired to pursue water resources management because, unlike many other fields, the facts about water are easily verifiable by everyone. For example, water exists in 3 states of matter: liquid, solid, and gas. You can easily observe that. If you doubt it, you can easily experiment on it. Another reason will be that water is crucial to human development, playing a key role in almost all the sectors there are: food production, energy generation, and ecosystem support, to mention a few. So by working in this field, I figured I can make a meaningful impact on humanity. So that's it.
And could you also share how your academic experiences at Funab, at Wageningen University, and at Cranfield University helped shape your interest in integrating water safety and gender perspectives in your work?
That's an interesting one. And I kind of figured that question will pop up when you said you will start me off with a Q&A. So I would say I had a career defining experience during my master's fieldwork. And that's actually when my interest in integrating water safety and gender, was inspired. For my dissertation, I conducted a comparative assessment of the role of rainwater harvesting for productive use in urban, small town, and a rural area in Nigeria. However, I had an interesting encounter in the selected rural community I worked in. So I got a slide in here where I figured I can give you just a minute. Okay, a bit of a background into that work. That particular community, for those of you who are familiar with the area, somewhere in Irua, Edo State, Nigeria, the community relies almost entirely on rainwater. Other water sources, a river which is 5 kilometers away, and an industrial borehole that's even further away, 7 kilometers. And this is because the groundwater is just not readily accessible. The geological terrain, the area is underlain by coastal plain sands, locally called Bine Formation. And if you're familiar with geology, you know that coastal plain sands are, typically poorly consolidated, highly porous. And in that area, the thickness is about 600 feet. In other words, the groundwater table, below surface is around 169 meters. So that's not an easy, location to be digging, well, for those community. And even industrial borehole, you need to know what you're doing to be able to get one on the way. So in another area of context is differential water roles practices. Men, as property owners, provide the rainwater harvesting structure or the system. So typically they pay for it, the construction and the maintenance. Women, their own share of the cost of construction is provision of food and refreshment to construction workers when the system is being set up. Young men and boys will handle the maintenance activities like cleaning and repairs, but it's almost exclusively the duty of women and children to draw the water and make it available for use in the house. But if no woman and child is available, men do draw for their own use. But culturally, men, especially heads of household, will not fetch water from the streams or the river. So that's a bit of background, and you can see in the picture there what the rainwater harvesting structure looks like. So they will tell you it is a well, but it's not the hand-dug well as we know it. It's just a rainwater harvesting structure. So to your question, I've met with the community heads. They told me the best time to catch everybody is during market days, and market days also doubles as community meeting days, So they gave me a date. I was there with my research team, and we organized focus group discussion, women, men, the youth, key informant interviews and the likes. And at some point, with some youth volunteers, we took a transit walk around the community to take, observation, measurements of the rainwater harvesting structures and the likes. Along the line, all of a sudden, I just got accosted by this group of matured, quite elderly women, and in their numbers, and just threw me in the middle and was accusing me of all sorts. You're also a woman. You're not interested in our own perspective. You've not carried us along. And I was like, excuse me, I really don't understand. Are you from a neighboring community or what? Anyway, to cut the long story short, it turns out it is a taboo for married women to be in a village meeting. So all the women I've seen before then were youth or unmarried women. And I wouldn't have known if that situation had not occurred. But the implication of that incident is that by the time, we all calmed down and I started to interact with them and about the differential water roles and practices, they told me something remarkable that actually changed my perspective, about water resources management, in my career. They said, because of the difficulty in getting water, sourcing for water, having to tread long distances and all that, they have to prioritize household water uses. And any water that gets itself into the household, especially during the peak of rainy season, that's from December to anytime in March or April, is strictly used for drinking and cooking. So I got curious and I asked them, but you're women. I understand, hygiene issues for women. So how do you deal with that? Then they said, yes, well, they're farmers. After the day's work, they will just sit on the bamboo, lie down on the bamboo benches in front of their huts and just allow the cool breeze of the, of the day to dry up their sweat before they retire to bed. That was a shocking discovery. That was my wow moment in my career. And when I knew that, no, this is something I actually needed to take more seriously than I had. Anyways, thank you for the opportunity to share my wow moments in my career. I'd like now go to, my presentation for the day. Hopefully, I'll be able to talk you all through it very quickly. So in terms of outline, I'll start by talking, why water sanitation and hygiene, explaining briefly the importance of WASH in global development and how WASH intersects with gendered health impact, followed with what differential impact analysis is all about, talking about the benefit, challenges, approaches, and finish that with a real-time application of a DIA assessment that we conducted here at UNU-INWEH. And finally, end with the policy and practice implications. All right. Is water, sanitation, and hygiene, acronym WASH, is it really an existential threat? The UN Secretary General, answered this succinctly. He said, and I quote, "Water is health, water is dignity, water is a human right. There is nothing more fundamental to our very existence." It couldn't be more correct. The Executive Director, UN Sanitation and Hygiene, introduced the angle of sanitation by saying, water is life and sanitation is health. I believe you will agree with me that is also on point. So in terms of the fundamentals, just as in the quote, access to wash is the most basic human need for health and well-being. We cannot stress that enough. Again, the centrality of water to poverty, reduction, food security, peace, and human rights, ecosystem, education, cannot be overemphasized. Water is just intrinsically linked to any human development. So access to wash is really a human right. But yet there are challenges, which we're also familiar with. Rising water demand due to rapid population growth, urbanization, increasing water needs from the other sectors, or also less predictability of water availability in many places. We're also familiar with this. Drought-induced water scarcity, negatively impacting people's health and productivity, threatening sustainable development and biodiversity globally. Another important challenge, hotspots is the unabating lack of access to safely managed wash. And we have this, the GMP produced these statistics, and, the statistics even up till now are very, staggering. So wash is attributable to many disease bodies. This is the WHO assessment. The latest one yet is 2019. I believe another one will be out, soon. But we can already see how millions suffer, diverse preventable diseases. Underline preventable, Then unsafe wash is associated with infectious diseases or risks from chemicals and other contaminants. So the disease burden is really quite high, associated with water-related diseases. I also want to flag another important issue, which is the effect of the emerging pressures. We hear this over and over. This figure gives an overview of, the climate sensitive health risk, how climate, change pressures superimpose on the existing interlinkages between WASH and health risk. So we can see from the vulnerability factors to the exposure pathways to the environmental, social, and public health determinants, it's just all linked. It's in there. Another thing that I would like to say very quickly, like I said before, if you have time, is the linkages between WASH and gender equality. This I won't want to gloss over, but I also believe that we are familiar with some of this, but I try to highlight some of the scenarios, the major scenarios, between WASH and gender equality. Maternal and newborn health. From the experience I shared earlier, women predominantly and girls, carry water, is a responsibility, domestic responsibility, socially constructed, responsibility. And this impacts on them. In pregnancy, if you do this, it threatens, the pregnancy, low birth weight, slow child growth, and all that. The linkage is there. Another angle to read is women are often vulnerable to harassment and violence when they travel long distances to fetch water. Again, I alluded to the example I shared earlier, or use shared toilets or practice open defecation, often waiting, until nightfall to defecate, which increases the risk of assault. I can give more lived experiences, examples of how this still happens in the 2025 of 21st century. Another angle of impact, scenario between the linkages, WASH and gender is education for girls and young women. When they lose the time they're supposed to, be in school, spending it on collecting water, or finding a suitable place for them to urinate or defecate, these are real, and yes, it may not be real in some aspects of the world, but in the majority world, which is the global south, where majority of the world resides, these are still living day experiences for millions of people. Another aspect that I would like to highlight is economic empowerment. Women and girls perform most of the unpaid labor linked with WASH, collecting water. I believe if we start to pay for every volume of water, every liter of water a woman or a girl child, collects, women and girl child will really be very rich. I think we need to pitch that, at some point, so as to increase empowerment opportunities for women and girls. Anyway, let's move on. So now, in terms of differential impact analysis, how does this apply? I'll start by providing the generic definition of differential impact analysis. This would be the examination of the varying effects or consequences of a particular phenomenon, policy, or intervention on different populations, groups, or geographic areas. And the essence will be to identify and understand how the impact or outcomes differ across these different entities. But it's also important to highlight the fact that DIA, is in the scientific space. In medicine, they have a lot of, literature, pointing to differential impact. In marketing studies, pointing to differential impact. In transportation research, pointing to differential impact. So it's not entirely new, to the scientific community. But within the water gender team, differential impact analysis will be the evaluation due to gender differences across age groups, or evaluation disaggregated by sex and age group. And this again will be to unmask typically unseen gender effects of water-related services, practices, and events. But I need to highlight the fact that the concept of gender, though perceived as a social construct, typically described in femininity and masculinity, transcended by linear sexual identities to multisexual identities. I know this is a very topical issue, at this time, but the point I'm trying to drive at here is, if you want to if you want to acknowledge and work towards the addendum to this Sustainable Development Goals or leave no one behind, then onus lie on us to capture the lived experiences of every human, regardless of how they choose to present their identity. They are fundamentally human beings. So the experiences of every human being, if you care so much about plants, if you care so much about animals, then onus lie on us to capture the lived experiences of every human being. If we will not be paying, lip service to leave no one behind. I also need to say very quickly that gender construct is not a shorthand for women. Neither is gender and water interactions connotes the need to address only female vulnerabilities. The idea is to target human beings in our diversity. So if you want to talk about a 3-minute definition, a 3-minute code for what DIA is in water research, I would say DIA is an in-depth impact assessment disaggregated by gender and age group. 2, capture the holistic human lived experiences, unmask the typically unseen gendered effects of water and climate-related practices, services, events, or in this era of climate actions, impact assessment of those climate actions or interventions. Water and climate-related impacts are not gender neutral due to inequalities caused by physiological composition. I was still, raising that point with Dr. Axel shortly before we started this talk. We are different. Physiologically, our composition is different. So age, socioeconomic conditions, among others, these are the differences we have that will not make water and climate-related impacts gender neutral. Lastly, the lack of such data often obscures differences in gender experiences. This results in missing information or inaccurate reflections of the population. We will be missing out, and that should not be the case. All right. DIA, effective DIA will normally provide a deeper understanding of the specific ways in which water-related issues affect people or groups differently. In other words, it improves understanding. Another benefit will be that it helps stakeholders make informed choices based on empirical evidence, allocate resources effectively, implement appropriate interventions, and develop evidence-based policies. That's another benefit. Again, it helps to identify vulnerable populations or subgroups that are disproportionately affected by water-related issues, while also very quickly, it speaks to equity and social justice. And with this, I want to flag, for the purpose of those of you being interested, there is a study conducted by UNU-INWEH on inequity behind levees, where water-related impacts, of different population groups living behind water levees in the United States was studied. It would make an interesting read for you to see, the importance of differential impact assessment in flagging, issues related to people who are disproportionately affected and pushing towards equity and social justice. Of course, there will be challenges. The first one I want to flag in terms of, a challenge around differential impact analysis is the issue of data availability. Text-dactylated data is just not available. So scarce as at today. Every attempt to populate text-aggregated data is welcome because this is really scarce. Another important challenge will be the contextual variation, and I believe you will appreciate this, because the differential impact assessment, of course, you'll be analyzing, issues depending on geographical locations, socioeconomic factors, cultural practices. We already talked about the differences in gender, demographic characteristics. So this kind of analysis will require nuanced approaches, to consider, all those disparity, regional, urban, rural divides, specific vulnerabilities, which add their own different layer of complexity to the analysis. So we need to be aware that is not business as usual when conducting differential impact analysis. Of course, because often we relate with people, ethical considerations become something, that you cannot gloss over. Conducting research on vulnerable populations and analyzing differential impact should be approached with ethical considerations in mind. Protecting the rights and privacy of participants, ensuring equitable representation, and avoiding further harm or stigmatization is really important. In terms of policy, translating research findings into effective policies and intervention to mitigate the differential impact of water-related problems cannot be ignored in the context of differential impact analysis. Implementing targeted interventions require multidisciplinary collaboration, and this is very critical. I've already talked about water, sanitation and hygiene, again, health, and gender equality. So those are three strong pillars that will require strong multidisciplinary collaboration, across a lot of sectors for us to be able to walk through, an effective differential impact analysis. Before I share the practical example, I also want to flag some of the approaches, that one can apply when conducting differential impact analysis. The first one I flagged is participatory approaches, where, for example, you can engage, community based on a participatory research or citizen science initiatives. This really empower the people or the community to contribute their knowledge and perspective to the analysis. If we look back to the interesting story I shared at the beginning of the presentation, if I'd not been accosted by those matured women, I wouldn't have captured their perspective, because I wouldn't even have known, I wouldn't have had the information presented, to me in that dynamics. Another approach will be socioeconomic survey. This we're familiar with, often conducting surveys, that can provide valuable data on socioeconomic indicators. So if you really want to disaggregate data, we need information on income level, of course, the gender, employment status, living conditions around water-related impact. By comparing these indicators across gender and age group, we can assess the nuances, that exist, in that regard. Again, qualitative study is another approach, where examples include interviews, focus group interviews, case study, key informant interviews. We really have quite a number of examples on qualitative study. This can also help capture the social and cultural context of water-related impacts. The only way to know is by asking those who have the lived experience. Then another approach is applying geographical information system. I know a lot of people enjoy GIS analysis. This can also be applied in a differential impact assessment, and this particularly helps to visualize the differential impact of water concerns on different groups, communities, or region, and can also facilitate the integration of various data sets and assist in identifying areas that require targeted interventions. The last one, mixed method approach, is likely to be the most common differential impact assessment route, where you may need to combine, methods, any of the ones I've talked about previously, to comprehensively understand differential impact. But the choice, of any of them will depend on, of course, the research objective, the available resources, data availability, and the specific context being studied. Okay. Sharing a real life application of differential impact analysis. I was privileged to design and implement, with a group of researchers here at UNU-INWEH, water quality, a study on water quality and gender intersection. The background to it is, in research, we know that there's a lot of work that's been done between the linkages between unsafe water and public health, and we're all water users, so I know, if you drink contaminated water, you're likely going to come down with gastrointestinal issues. This is because water has this unique quality of dissolving almost anything in its path. So this makes it the primary transmission route of pathogens or chemicals to millions of people. Of course, with consequent morbidity or mortality, of millions yearly from water-associated diseases. So we have a lot of work in this regard. Another aspect, of study that is very common or popular is impact assessment of anthropogenic actions. By anthropogenic, we mean human actions, your own activities. All the land use activity that fits back into the water stream, all your hygiene activities, everything that you do, how do they impact on water quality itself, or how water events like flood, drought and the like impact on water quality. We have a lot of focus, in science literature on this aspect. Other areas would be the influence of water-related factors on health issues that are specific to women or men or boys or specific to girls. A good example would be the investigation of diarrhea diseases, especially in children less than 5. I'm sure you agree with me. Studies in this, in this area is too numerous to count, because, is a topical issue. So we have a lot of that. But what is essentially missing is an holistic analysis that will pick a phenomenon or consequence and investigate how it affects men, women, boys, and girls together, a holistic study. The other number 4 and 5, are also very common in literature. Water-related health risk assessment, often, a good example will be heavy metals, where we're, assessing the potential health risk to, due to exposure, of heavy metals, for instance. So the research gap, to kind of crystallize the research gap, is that we have a lot of common rhetoric. For instance, climate-induced water quality and disasters affect men and women differently. But how differently? The extent or magnitude of such differences is rarely investigated nor reported. Another gap will be the global blind spot, that even at the UN, at the global level, only until recently, by recently, I mean last year, 2024, the focus of monitoring WASH services had primarily targeted the general population. So if you're familiar with SDG 6, you'll be asking what is being monitored is the proportion of the population that have access to safely managed, water services, or safely managed sanitation services, or, a basic hygiene facility and the like. This monitoring has not been disaggregated until in the recent publication, where they have a bit of, a few sections just to flag, flag some disaggregated data, and hoping to expand on it going forward. We hope we'll see more of that, going forward. So the idea is we're actually against the clock here. More than halfway, pretty much less than 5 years through the SDG era end date of 2030, there is still a lack of monitoring of differential access to WASH services and its impact analysis. For water or WASH research, this has huge implication. Yes, 5 years may not be a lot, but it's still a good time to double up in terms of, leveraging differential analysis to push, for, all this. All right, so for the study, the objectives, the four major ones is to investigate real-time interactions between water quality variables and gender, to uncover hidden gender-specific health impacts and associated outcomes, if any. Another objective is to develop and implement a framework to analyze or monitor location-specific health and socioeconomic impacts around poor water quality, hoping that these will, we can leverage these to populate data disaggregated by sex and age group, particularly in developing countries. The third objective is to highlight the overall outlook of the gender-specific impacts, due to unsafe water in a piloted case, and identify the unequal impact gaps between women, men, boys, and girls that must be addressed to minimize health and socioeconomic disparities. And of course, develop a policy advisory on gender appropriate wash, health and socioeconomic interventions, to address, any differences, that differential impacts, that we picked up in the study. So I guess the logical question will be, did we achieve that? So in terms of the methodology, like I said before, effective differential impact assessment will necessarily mean you combining methods. So definitely is a mixed method approach. I provided a glimpse, a snapshot of Abeokuta City, Nigeria, is an Asian city, but sits pretty there in Southwest Nigeria. So in terms of the mixed method approach, it involved, field work, where primary data were targeted, in Abeokuta City, Nigeria. Health data were collected, water quality sampling and analysis, and the public survey. These are quantitative approaches. Then of course the literature review, where we took to secondary data, harvested secondary data from open access media, online and print documents. Of course, we also leverage GIS, to particularly produce spatial distribution maps of the hydrochemical parameters that were identified. All right, just to give you some highlights, of the field activities, in terms of the medical record, we targeted 15 months prior to the field work, of medical records from 10 primary healthcare centers called, acronym PHCs, so information, extracted, where for example, the patient's age, the gender category, the diagnosed water-related infections, from each of the primary healthcare centers. These were targeted, we targeted differential water-related health cases to be able to identify the prevailing water-related health issues in the city. The water quality assessment, the sampling, in situ and laboratory analysis of water sources, being used by the most immediate communities, of the selected public health centers. The moment we identified and selected the public health centers, one of the first things we did very quickly was to delineate at least a 1 kilometer radius wide, where we now the reconnaissance survey to identify the water sources, predominant in those locations. And this will be hand-dug wells, boreholes, surface, and packaged drinking water. Those who are familiar with that terrain, by packaged drinking water, I mean the sachet water. They call it, in fact, locally they call it pure water, but I always tell them there's no pure water anywhere. Now, in terms of parameters, we assessed 28 parameters, 4 of them in situ, 4 physiochemical parameters in situ, 16 hydrochemicals, and 8 DNA-specific pathogens to check the prevalence of waterborne zoonotic pathogens in the water sources. In terms of the public survey, another approach to it, we surveyed 456 participants, and questions, captured at least 6 major components of water and gender interlinkages, such as water, sanitation, hygiene practices, menstrual health management, menstrual hygiene management, health culture and practices, and of course, the socioeconomic factors. These helps us to understand how those components influence, the impact of water quality on WASH, and, on gender. In terms of data analysis, we conducted health risk assessments of hydrochemicals with potential toxic health effects. These we identified from the water quality analysis that we did, so they included 6 parameters: calcium, magnesium, iron, manganese, zinc, and chromium. And of course, gender analysis. Here we applied the Harvard analytical framework, the activity profile. So who does what, who has what, what's the socioeconomic context and the gender considerations needed, so that was also done. So the assessment framework pretty much looks like this. It's a 5-step differential assessment framework for, of a water quality and gender study. But this can be replicated. It was well piloted, and the successful piloted case is actually the proof of concept, of differential impact assessment as we know it. So from method design to water sampling and laboratory analysis, public survey, as I've explained, health data collection, and feeding into data and gender analysis, then of course, all that roped into the interlinkages between SDG 5 and SDG 6. And you can see what goes on into each of the steps, under them, so this you can get a full detail on in the publications, because we already have 2 work in this regard that that fully published. All right, so do we have differential outlook? Of course we do. This figure represents the differential health susceptibility in percentage of hazard index to the hydrochemicals, and you can already see from the figure women, men, girls, and boys, the nuances. We won't have been able to see how differentiated the statistics are if you have done a generic public health, assessment. Another clear example of differential outlook is in terms of the water-related diseases. Of the diagnosed cases, that we collected over the 15 months, 67% were actually water-related illnesses. In other words, the illnesses that are being reported, and recorded within the primary healthcare center, more than half of them, well over half of them, has to do with water-related illnesses. And we can see how disaggregated they are here, where we have more women than children and men, suffering a water-related disease. Another differential outlook, I'll just go through this very quickly, in terms of health culture and practices, it's also very, very, very interesting. I want to particularly flag this self-medication. You see the percentage of men, practicing self-medication, relative to the other gender group or age group. All right, so in summary, water-related impacts are not gender neutral. So the idea is, if we go in with a differential impact analysis lens, we will see nuances that would normally have been ignored if we had not leveraged differential impact analysis. Like I said, these are some of the publications that you can during your spare time, take time to go through them. You have good details, of all the things I've been talking about, especially on masking the unseen, the gendered impact of water quality, sanitation, and hygiene can easily be downloaded from UNU-INWEH website. All right. So to wrap up, in terms of policy and practice implications, we did ask, one of the objectives was, to provide advisory on how to address, any identified, gendered impact. So this is, a summary of that advisory, relating to the case study, the piloted case study. So in this instance, in that location, it's better promoting menstrual hygiene management, particularly for girls, is one of the top priorities. Empowering women economically in that terrain, in that local, will enhance, better healthcare, decision, because it turned out women take agency, for healthcare in that city. Prioritizing equitable access to wash and adopting gender mainstreaming approach in water, wash, or integrated water resources management. I want to talk a bit more on the importance of gender mainstreaming, adopting gender mainstreaming. We've seen in literature that gender mainstreaming actually improves not only gender results, but also wash results. So it will be strategic to couple SDG 5 and SDG 6. The idea is accelerating gender equality, which is SDG 5, will lead to accelerating SDG 6. And this is also important because, as we started, of the centrality of the role of water. So leveraging linkages across sectors, which is also promoted, by UN, SDGs, is so critical here. So wash and gender equality contribute to achieving other sectoral goals across the development agenda. So again, I say it is strategic to accelerate SDG 5 to accelerate SDG 6. Now, in terms of takeaway, I'm wrapping up very quickly. Like I said before, DIA helps, it provides a huge opportunity, for WASH research. The outline knowledge gaps have huge opportunities here, to explore DIA of water-related, or climate events related disasters, water services and practices, among other things. It's also important, if you don't take any other thing away here, to mainstream sex-aggregated data and evaluation. It came out as an issue, one of the problems we're facing, sex-aggregated data is just scarce. So gender statistics is the missing link to unmask the unseen differential impact. And there's urgent needs to populate sex-aggregated data and evaluations through DIA. And I also want to flag a good example of an innovative water security research tool, which is great for DIA, and it also helps in populating sex-aggregated data. You can look out for it, the water insecurity experiences skills, being designed and promoted by Northwestern, University in the US. Lastly, I want to flag the issue of multidisciplinarity and multi-agency collaboration. It also came out strongly that addressing the challenges of DIA requires interdisciplinary collaboration among experts, hydrologists, public health, water and environmental science, economics, sociology, policy making, and not to forget behavioral science and psychological sciences. We need interdisciplinary collaboration in an effective differential impact assessment. So to translate research findings into effective policies and interventions, UNU-INWEH welcomes research collaboration in this regard. And if you must do an impact assessment, now, regardless of whether it's environmental impact assessment, social impact assessment, socioeconomic impact assessment, what have you? Make it differential. You can leverage the same resources, the same energy, the same, level of expertise in ensuring, in conducting differential impact analysis. So rather than just taking a generic view on your impact analysis, make it differential, disaggregate your data. If you do not take anything away from this science talk, please let this be your takeaway. Leverage differential impact analysis in any of your impact assessment. Thank you. Questions?
Professor Grace, for a really fabulous presentation. We already have a question in the Q&A box, so I'll start with that. How could subjective and objective data collection processes affect DIA results and implications or policy development and formulation?
Subjective data collection and
subjective data collection and objective data collection processes, how could they affect DIA results and the implications for policy development, policy formulation?
Okay, thank you for that question.
And you can unshare your screen as well.
Okay.
Thank you.
So I should stop sharing. Is that what you're saying?
Yes.
Okay. All right, thank you. Nice to see everyone. Yeah, I already flagged it when I was talking about the challenges, that differential impact assessment requires, nuanced approaches, that if you're faced with subjective data collection, there's something we called in social sciences, taking a step back, or if let me cite this example. If you're going for a qualitative interview, for instance, in a terrain where you know very well, you need to take a position of informed ignorance. I guess that's the word I'm looking for. In other words, you separate yourself, as much as you can, take this position of an informed ignorance, as if, okay, for example, in the case study, is a terrain I know very well. When we went out to talk to the people, I wasn't imposing my ideas or the knowledge of the area, on them. I was rather interested in what they have to say about the questions that we are posing. So it numbs in a way, subjectivity. We need to be aware of these, in our design of differential impact analysis. And in terms of objectivity too, that's why, the research design, is also quite important. Before you go out at all, literature review will help. So you're familiar, then interdisciplinary also comes in where, experts come together to query the research questions. For instance, in an ongoing project that we're doing, co-developing the research questions, just critiquing, just before you take all that to the field. So it's doable. It's challenging, but it's doable. I hope I was able to answer that question.
Thank you. Yeah. And I guess just to go back, I'm still sort of quite shocked by some of the staggering figures that you presented in the beginning, that 3.5 billion people don't have access to sanitation. 1.4 million deaths in 2019 could have been prevented due to diarrheal diseases. 69% of diarrheal diseases are attributable to lack of wash. I think that's something that right now, with the wildfires that we saw in California, it's really tempting to sort of say this is directly attributable. And so that, the fact that 69% of it is directly attributable is really quite shocking. And then, mind blowing again when you got to the conclusions of your research that 82%, the differential impact, 82% of diarrheal diseases versus 18% for men. And I guess I'm wondering with something like this, where there's a clear, objective to reduce these preventable deaths, how might you go about implementing a targeted intervention that would deal with that differential impact disparity?
All right. One of the advantages of differential impact is to be able to identify, those who are most vulnerable. So if I look back to the case study, calcium toxicity was flagged in that research. The concentration of calcium in all the waters, that we assessed was actually above the threshold. So that's why calcium was included in the health risk assessment. And by the time we estimated the health risk due to calcium, it's actually more men and boys than women and girls. So in that regard, if there's something they do in the UK, if you're above 40, I'm not so familiar with, I don't know if they do that here, but NHS will send you a letter when you're above 40, then above 50 to come in for mandatory checks, So if such is known that men and boys are susceptible to calcium toxicity, for instance, in that locale, so it can now be included in the compulsory health check, for men and boys. These are some of the things differential impact analysis could help achieve, targeting, those who are more, impacted in a particular, location or in a particular issue, around water related, so that's one clear example that can work.
Could you want to?
Oh, okay. Hi, Grace. Thank you for that fantastic discussion and presentation. I was wondering, with regard to some of the most important methods for DIA that some of which you highlighted, such as surveys, we're currently seeing some critical threats to some of the widest ranging tools the world has at its disposal. So, for example, USAID has historically funded the Demographic Health Survey. With the scaling back of their work, the future of the DHS is in question. Many of their data sets have been taken offline. So these large surveys can be technically complex and costly to implement. What are alternatives or alternate or emerging methods? Do you have any sense of those that we should be looking at strategically? AI or otherwise, just your thoughts on that.
Yeah, that's actually that's why I included that example of the WISE skill. The water insecurity experiences skill. It's designed by Northwestern University and it's quite gaining good grants. It's quite an innovative skill and simple to use. It can be integrated into any national survey very quickly because it takes just about 3 minutes, I think. So I dropped the link in my PowerPoint. So it's one example of how a water related tool that one can leverage, and it's quite simple actually, and it can be integrated into any other elaborate research that is ongoing. One can leverage any other research, include the WISE skill, and collect data disaggregated across gender lines, and on water security issues. That's one great example. Yeah.
And then we have I think time for one final question. Sidigi says, thank you for your inspiring presentation. I have a question regarding your survey participants. Did you take into account the percentage of women among them?
Yes, in fact, we had to. It was balanced, because of course is an exclusively gender specific research. If you understand what I'm talking about in that regard, so we went in ensuring that we have balanced representation across women, men, boys, and girls, and of course, estimating what would be the representative size within the population, of the case study that we selected. Yeah.
We got one last question. If you're willing to take one very final one.
Is
Thanks,
it from
Dr.
Ame?
Grace. It's anonymous, but
They don't let me. You're so popular. I can't ask. Okay.
very useful assessment and highly needed to support mainstreaming efforts for gender mainstreaming and having reliable disaggregated data. The question is, can the DIA framework be used to develop software application that can help to replicate your amazing work in larger scales?
Fantastic question. And I really appreciate whoever posted that question. The answer is yes. And I hope very quickly, I will have people rushing to do this, or my colleague Martin, taking lead in ensuring that we get this into, design and have, for it before it is hijacked. But yes, differential impact assessment can be leveraged, at every sector. I've made that clear, from this presentation. So yes, it makes a great sense to, apply any new technology to ensure that DIA becomes, readily, available in the hands of scientists who needs it, be it in water research or elsewhere. Yeah.
Oh, thank you. And then I think with that, I'll turn it over to you for a final word.
Yeah, I think we're over time, so I'm not. I will not ask about your research, like a research question, but so fantastic work. Thank you for the presentation, and we know, we know that the impacts are different. I think people like you try very hard to promote that, to make people pay attention to this very important and crucial matters. And as you said, this is not even a problem of the South. The different impacts are important in different groups. It's not even limited to gender. But with what is happening in the world, how do we, what should be our efforts in academia to stay factual and ensure that these important issues would not be overlooked?
Thank you, my director, for that. I always appreciate your perspective on issues. I will approach your question this way. When I started, I asked the question, is water or wash an existential issue? If the answer to that is yes, then we cannot afford, under any circumstance, allow our focus to be taken away from water and wash issues. That's one. Number two, gender inequality. Is it real? Or is it, a construct? Is it just a fiction? So if we agree that it represents lived experiences of people, and especially in the global South, where, again, I keep saying that's where the majority of the world, resides, then it becomes important. It becomes significant, substantial issue that we cannot ignore. In all war zones areas, right now, all these are being perpetrated. So are those instances real? So if they are, if our answer to that, if our fundamental answer to that is yes, then we cannot ignore any of this. We just need to keep pushing. We just need to keep pushing. We just need to keep pushing back. That's my sincere answer.
Thank you. Thank you. Thanks for the great work you're doing.
Thank you for having me. All right. Take care. Thanks,
Thank
everyone.
you so much, Professor Grace. Thank you all for joining us.
Thank you.